Today's class is about epithelial tissue. So epithelial tissue is mostly present on the body surface and lined hollow organs, body cavities, glands and the duct. Epithelium tissue is avascular but has their own nerve supply. Based on their structural modification, it is classified into two categories: simple epithelial tissue and compound epithelial tissue or stratified epithelial tissue. Simple epithelial has a single layers of tissue against the compound epithelial has a multiple layer of epithelial tissue. Based on structural modification, epithelial tissue is classified into five categories: squamous epithelium, cuboidal epithelium, columnar epithelium, then ciliated columnar epithelium and pseudo-stratified epithelium. Squamous epithelium tissue. It consists of single layers of flat cells resting on the basement membrane, nucleus present inside the cells. So it mainly helps in diffusion of substances and secretions across the epithelium. Squamous epithelium mainly located in the inner line of blood vessels, then alveoli of the lungs and in the Bowman's capsule of the kidney. Coming to the cuboidal epithelium tissue, it consists of cube-shaped cells of single layer resting on the basement membrane and the nucleus present in the center. So it mainly helps in absorption and secretions. That's why it's mainly present in the duct of so many glands and in the renal tubules and in the inner surface of ovary. Coming to the next, that is columnar epithelium tissue. It is a single layer consists of rectangular shaped cell resting on the basement membrane with spherical nucleus present at the base. Surface of columnar cell may have microvilli. Columnar cells helps in secretions and absorptions. Thus, these tissues are mainly found in inner line of stomach and intestine. Coming to the next, that is ciliated columnar epithelium tissue. So there is so many microfilament hair-like projections above surface of the columnar cell is called cilia. So its name itself suggests that it is ciliated columnar cell. So cilia is a hair-like projections that helps in the movement of substances in a particular directions over the epithelium. Ciliated epithelium mainly present in the inner line of bronchioles and in the inner lines of oviduct called fallopian tube. To the pseudo-stratified epithelium tissue. It is a single layer of columnar epithelium cell, but still it's look like a double layers because of different length of the cell and the nucleus. They are located in the inner lining of urinary tract and in the trachea and olfactory mucosa. So these cells secrete the mucosa and the cilia present in these cells helps in expulsion of foreign substances in the outward direction. Coming to the functions of epithelial tissue, it protects skin from sunlight and bacterial and physical damage, absorb the nutrients from food and filtrate the waste product from the blood and secrete the perspiration, well digestive enzyme and mucus. Thank you.